Hey everybody, Dr. Amir Rahemi here. Just wrapped up a consult this morning with a healthcare coaching client, and we review things like their medications, their supplements, lifestyle habits, etc. But something came up that I wanted to share because I think it may help you or potentially your family members, because the use of this medication is just ubiquitous. We dispense it probably 30 times a day, unfortunately. And so what it was a medication called Pantoprazole, right? And this patient had been taking it every single day for over a decade. Now look, medications like Pantoprazole, they're called proton pump inhibitors. And you might know it as omeprazole, Pantoprazole, Nexium, Protonix. They go by a lot of different names. And they can be really helpful actually in the short term to help with things like acid reflux or healing ulcers, but long term, you can really run into some pretty nasty consequences by taking it. Probably the number one thing that I would be concerned about is nutrient and bone health, right? When you block acid for too long in your stomach, you prevent your body's ability to absorb key nutrients. Things like magnesium, calcium, and vitamin B12. And listen, if you follow my channel, you know that these nutrients are essential for energy, good nerve health, and strong muscles and bones, right? So when they run low, you start to feel fatigued. You have muscle weakness, even numbness for some people, and eventually bone loss, especially in women. Now, most people have no idea that their heartburn pill is connected to any of this. So make sure you're aware. Number two, this one's kind of personal because I'm seeing more of my patients and even family members who are struggling with kidney health. And there's been some new studies out that are linking long-term PPI use with kidney disease. It often starts slowly with inflammation and mineral imbalance. And many people don't realize that there's a problem until their lab work shows like early stage kidney disease. So if you've been on these meds for a long time, please talk to your doctor or pharmacist, review your labs, and just make sure your kidneys are functioning well. Third thing I would say is there's a proper way to get off of these medications. So if you've tried to stop it in the past and felt worse than you did before, it's not proof that you need it forever. It's just called rebound acid, right? And it's just your stomach temporarily recalibrating the system. But it's better not to go cold turkey. Call us down at the store or work with your doctor, and they'll help you to taper off of it slowly with short-acting meds or even natural support to ease that transition off. Now, here are the things that you can do or that are not related to medications, right? You wanna focus on root causes. So what I've found in my practice over the years is having big late night meals, overdosing on caffeine, having too much alcohol, right? We see this mainly on cruises. People go and they just eat and eat and eat and drink and drink and drink. And by day 3 of their cruise, they've got massive heartburn, right? It's these lifestyle things that we're doing. Even low magnesium can make reflux worse. So when we address those root causes and support digestion with things like magnesium blends, smaller meals, better timing of our meals, balanced portions, most people realize they never needed the PPI to begin with. So listen, if you've been taking these medications or other antacids for a long time, this is your sign. Get a check-in, get a review, see a pharmacist, see a doctor, come see me if you want. This is exactly what we cover in our health optimization consults. If you're looking to have somebody do a deeper dive for you, figure out what's holding you back and help you rebalance naturally, I'm here for you. I am Dr. Amir Rahemi. Hope to see you all soon.